Professor Salim Abdool Karim is an epidemiologist at CAPRISA and chair of Africa's CDC Emergency Consultative Group.
So I chair the committee of 20 scientists in Africa that advise the Director General of the Africa CDC. And we were asked to review all of the data. And when you look at the information currently available, there are four concerning things. The first is that we in Africa right now have substantially more Mpox infections than we had 2 years ago when the declaration was made of an international public health emergency of international concern. So we have many more cases right now than 2 years ago. But also concerning is that the number of cases are going up. So it's not that it's just flat or just simmering, it's going up. The third is that we're seeing a case fatality rate. That's the proportion of patients who have the infection who then die as a result. And we're dealing right now with a case fatality rate of around 3%. And that's much higher than we anticipated we would see. But the other concern is that in the last few weeks, 3 more countries in Africa started reporting cases of Mpox. And these were countries that didn't have Mpox before. And all 3 of them have the same variant, the same clade 1b, that is spreading in the DRC.
Of course, we've also heard that in Europe, Sweden has confirmed a case of Mpox of this new variant, the clade 1b, which, as you say, is of more concern. And immediately, of course, we think of those terrible times of COVID. We think of the HIV/AIDS epidemic. But there's a key difference with Mpox. There is a vaccine. It's derived from the smallpox vaccine. Does that mean we're safe? And does that mean we should scale up the vaccines very quickly?
So one of the distinguishing features of the situation in the DRC right now, and that's in the South Kivu region of the DRC, is that we are seeing a transmission that's occurring heterosexually. In other words, where couples are passing the virus from one to the other. And when they interact with children, they're then spreading it to children, who are then, because they play amongst themselves, are spreading it within the children. So what we are seeing in the DRC is a situation of a virus that is sexually transmitted, but also transmitted through contact with children. And so that's what's driving this epidemic situation in the DRC. Now, to slow the spread of Mpox is not a big challenge. You do it with basic public health measures. That means case identification. Every case where you identify that there's a patient with Mpox, you've got to ensure that you isolate them, that you trace all of their contacts, people they live with, their sexual partners, and you ensure that they don't spread it onward. So that's how you control it. A vaccine could be a very valuable addition to those public health measures.
How confident are you that if we need to, we can scale up these vaccines?
But once we know that these vaccines are clinically efficacious, we really need to do much, much more to scale them up and to make them available, particularly in settings where we're facing real challenges in implementing public health measures. I mean, the problem in the DRC is not just that you've got this virus spread, it's spreading in a part of the country that is politically unstable. They are in a war zone. And so we can't even get the samples from the patients to the lab to do the testing. So there needs to be a political solution, there needs to be a public health solution, and there needs to be a technological solution with vaccines in addition to all of that.